What happens if your child hits their head? How do you know when to bring the child to the emergency department for evaluation? So this is the story of a 13-year-old boy who was in a swimming pool and he was playing around near the edge of the pool, roughhousing a little bit with other children, and hit his head on the side of the pool. Not very hard. They continued to play. There was no loss of consciousness. There was no mark at the side or anything. He seemed fine. About 10 minutes later, he started to feel a little bit of pain, and when you rub over the area, there was a little bit of swelling. 30 minutes later, the child has nausea and starts vomiting. He complained of increasing pain to the part of the head that was hit. There was still no, there was a little bit of redness, but no obvious trauma other than a little bit of redness. But he kept vomiting, so mom brought him into the emergency department. Because of the history of head trauma in the setting of intractable nausea and vomiting, a head CT was done and demonstrates this. The radiologist calls me as the patient is being wheeled back to his room from the radiology suite and says, your patient has a left linear temporal parietal bone fracture that underlies a significant epidural hematoma with compression of the lateral ventricles and a midline shift. The point of this share is twofold. One, it's hard to gauge how hard the head hit the side of the pool when there's a lot of activity going on, particularly in the water. But also to say that if your child sustains a head trauma, no matter how seemingly insignificant, and they subsequently have nausea and vomiting, they vomit more than once, they have a change in mental status, or they complain of worsening headache, that is an absolute trip to the emergency department for evaluation and a probable CAT scan of the head.